on Health is sponsored by Goshen Health.
June is Wound Healing Awareness Month, and tonight's Eye on Health report focuses on hyperbaric oxygen therapy. It's a medical treatment that uses your body's own natural healing process when you're exposed to pure oxygen. I found out what it's like to be in one, but when these machines are actually in use, they can heal even the most severe conditions.
This is what hyperbaric oxygen therapy rooms look like at Goshen Health. Pressurized chambers where patients breathe pure oxygen at a higher than normal atmospheric pressure. Dr. Mark RANZINGER is a board-certified surgeon at Goshen Wound Center.
Our goal here at the clinic is to try and help people heal wounds by about 14 weeks.
Many are diabetic, have radiation damage, some kind of injury, or facing amputation.
Patients with diabetes have a 30 times likelihood as compared to the regular population of having an amputation. They have neuropathy, can't often feel on the bottom of their feet, end up having an injury they weren't aware of. Took care of one diabetic patient who had a nail in their foot for 2 weeks, didn't know about it, came into the hospital, and we realized it there, and then they came to the wound care center after that.
Each patient is different, but typically it's a 2-month course of 60 treatments.
We check their ears because the pressure changes, just like when you're in an airplane, can cause some problems there. And the other thing we always want to check is their lungs, because you can have some problems with your lung under those conditions. There's a telephone, so we've got someone sitting here all the time while they're undergoing their treatment.
Televisions are there to distract and help with feelings of claustrophobia.
The oxygen that we normally breathe in is about only 20% of the air, but when we put you in the hyperbaric tank, you get 100% of air under a couple of atmospheres of pressure. So it's like being approximately 60 feet under the water for about 2.5 hours. And while you're there, you're getting 100% pure oxygen into your bloodstream and directly onto the wound, which helps speed it up.
And the vast majority of patients find great healing benefits.
Dr. RANZINGER says between 80 to 90% of patients are fully recovered when he expects them to be healed and finished with treatments. Hyperbaric oxygen therapy is used for all sorts of things too. It is proven to be successful in treating even carbon monoxide poisoning. Some believe it holds benefits for brain injuries, among other conditions, many of which, though, are not yet proven.